Welcome back. This is the video blog for the Women's Health Center at St. Helena, and we hope you're having a great day. Today we're going to talk about how to prevent the problems that we get in life. The cancers, the diseases. What do we do? How do we test for this? What are the preventative health guidelines for women? Well, the most important thing is to understand why do we do these. We do tests to pick up problems before they become problems. Pick up the risk factors or evidence of an infection, for example, that might lead to cancer in the future. And we've designed a number of different tests over the years to do that very thing. One of the best, most successful tests of all time, probably the most successful test in terms of saving lives, has been the pap smear. It's very interesting. What is a pap smear? Well, we've talked about it here briefly. A pap smear is just obtaining cells from the inside of the vagina at the cervix so that we can determine, is there some abnormality in these cells that has been caused, in most cases, by a human papilloma virus infection. So viruses are commonly causing problems that often can lead to cancer. So we do this pap smear, and the pap smear is a preventative test. It saves countless thousands and thousands of lives every year because we've started doing that for the last 30, 40 years, 50 years. At the end of the day, it's easier now. You only have to do them every 3 years from the age of 21 to 65. But there are many other tests that you can do as well. The mammogram, for example, or a clinical breast exam. These are tests that are typically designed to pick up breast cancer earlier when it's more likely to be treatable. Well, realistically, there's probably other great tests out there to pick up breast cancer, because by the time a mammogram or a clinical breast exam can actually detect a cancer in the breast, it has been there for as much as 10 years. Well, we would love to pick it up before then. And there are studies that are ongoing with thermography that you may have heard of. There's a lot of popularized mentality around thermography, which is checking heat changes within the breast. And heat is different in cancerous tissues than it is non-cancerous tissue. So it actually shows up earlier in or at least the suggestion is. But that study, that process, that still has yet to be worked out in the sense that it's truly been shown to make a difference. That being said, that type of study and further studies are constantly being developed to pick up cancers earlier than possible before in the breast, for example. Well, what other preventative health tests do we do? Well, there's the ever popular colonoscopy. What's a colonoscopy? Well, it's to check for colon cancer. Plumbing in the nether region. We're taking a camera and we're putting it in your bottom and looking up inside, literally with a video camera, to see, is there a reason that you might have a precancerous risk in your colon? Well, if you have cancer history in the family of colon cancer, then you would want to start doing that earlier than the normal cutoff, which is 50 years old in both men and women. You would start that 5 years before, 45 years. Unless the person in your family who had it very young, you would start it 5 years before they had it. And although it's uncommon, it certainly does happen. But it's the idea of finding a polyp or finding a lesion or even an early cancer when it's very small, very early, and easy to be cured. That's the key with preventative health. Prevent, and if present, find it early enough that we can cure it. So we have pap smears. Again, we start at 21 and go to 65 every 3 years now if there's no problems. We have mammograms, start at 40, go to 75 every year or two in that first 10 years. We would start that earlier if you had a first-degree relative, like a mom or sister who had the disease. We would typically start that at 35, or again, 5 years before that relative actually came down with the cancer. Colonoscopies, again, starting at 50, and those will continue every 10 years if they're normal, every 5 years if there's polyps, or more frequently if there's something else that the gastroenterologist or surgeon who performs that procedure for you finds. What other things are there? Well, there's diabetes testing. Pre-diabetes is a real disease. It's a real process. We believe that of the 20 million people who have diabetes, many of them don't know it right now. They have no idea that they actually have diabetes. And they probably had early signs of diabetes that could simply be tested for by a blood test. they probably had signs of that as early as 10, 15, even 20 years before the true onset of diabetes. Cardiovascular disease is the same. Cardiovascular disease can be revealed by a combination of family history, imaging studies, testing to look for changes in the heart, including echocardiograms, EKGs, and even CT scans looking at the functions of the heart and whether or not there's excess calcium, which is one of the problems that causes heart attacks because it blocks the blood vessels. When you get a plaque, which is related to calcium, inside your blood vessels of the heart, it ruptures and you can get a heart attack. Well, we can find those things out earlier and earlier now by doing preventative health testing and preventative health analysis. There are many, many other processes, including bone density tests. Bone density tests are frequently discussed because we're looking for osteoporosis, osteopenia, problems with weak or less dense bone, easily fracturable bone. They run in families. Certain patients, certain genetic makeups are more at risk. But when do you start doing bone density studies? We call it the DEXA scan, D-E-X-A. Bone density studies help us to determine that you do or you don't have that increased risk for a fracture, which particularly later in life becomes life-threatening in many cases, particularly with hip fractures and lower spine fractures, for example. That being said, when do you start that test? Well, a lot of people would start that at menopause, but that's not really correct unless there's other significant risk factors. In general, we typically wait till the 60s, mid-60s, to check women and 70 to check men in the standard normal situation where there isn't significant risk factors. But a significant family history, a significant history in your own self of broken bones after the age of 30, and other findings might actually suggest that your screening should start at the time you enter menopause. Because remember, we've talked about it here before, estrogen is important for bone growth. And if you don't have estrogen because you have an early onset of menopause or you had a surgical menopause by removing the ovaries, you may be at more risk for bone disease or osteoporosis. So that's the screening test for osteoporosis and bone disease. There are many other tests that are used out there. We don't have time for them all today, but it's easy when you check in with us at St. Helena Women's Health Center. We can help you go through the checklist, make sure that you're covered, that you're preventing any and all diseases that you possibly can. We'll be your partner in this process. And thanks and have a blessed day.